Columbia Morning, KFRU. We like having conversations about different health matters, and we've got one today that will probably catch the attention of a few of our listeners, and it has to do with kidney disease, and especially about a screening that is coming up. My guest is from MU Health, Kunal Malhotra, and he reminded me that we talked kidney stones last time you were here. Good to see you again. How are you?
Good to see you again. Thanks for having me.
So how prevalent is kidney disease?
It's very prevalent. 14% of U.S. adult population has kidney disease. Only about 10% of those in stage 3 kidney disease know that they have kidney disease. So there are no specific symptoms in early kidney disease. So there are a lot of people who have the disease, but they don't know about it. So that's the whole purpose of the event coming up.
So how can you detect then? What would you do at a screening? Is it a blood test or is it something else?
So kidney disease is detected by simple blood test and urine test. Although at the screening, we won't be doing blood test. We will be doing a simple screening by the urine. A urine sample will be collected, and that will tell us whether you have risk factors for developing kidney disease or not. There will be other things that will be done. They will provide a free BMI checkup. They will have risk survey, blood pressure check, a urine test, and there will be consultation with a clinician, all free of cost. To the public.
And what is the date of this?
This is on September 28th from 10 a.m. to 2 p.m. at the Columbia Library.
I like the idea of being at the library because sometimes people don't go to hospital settings or to medical settings very well. So at the library, do you have to have an appointment ahead of time?
No appointment needed, just walk in.
All right, 10 to 2 at the Columbia Public Library this Saturday. What does BMI? I guess it would be a whole slew of numbers and tests that you would need. Elevated BMI by itself may not indicate, but is it part of the diagnosing whether you have kidney disease or not?
So elevated BMI stands for body mass index. It basically tells you whether you are overweight for your height. So it's a risk factor for not just kidney disease, but for diabetes, heart disease, cardiovascular disease, and kidney disease. So it's a simple screening tool to tell you if you have high risk for these diseases.
And the blood pressure, similar?
Yeah, blood pressure will reflect whether you have hypertension, which is the number 2 cause of kidney disease in the country, number 1 cause being diabetes.
I didn't realize that. So those impact whether you have kidney disease or not. When I go for my regular checkup, like my yearly physical, and I get a blood test and I get a urine test, is a standard checking of those include indicators whether I might be having kidney disease at some level?
So for those are readily done, and some of those tests are done, and the regular yearly physical will include that, but but it's not standardized across the nation. So one of the things that National Kidney Foundation is trying to promote across the nation is to standardize kidney function panel so that we are checking for those things specifically to target and reach out to people who have kidney disease.
I guess one of the things we could ask then of our physician is, are the tests that I'm taking, a blood test or a urine test, will that also test for the potential of having some kind of kidney disease?
Exactly.
So if you have kidney disease and there were going to be symptoms, I guess at certain stages the symptoms do start to show up?
Yeah, and by that time the symptoms show up, you're already in the late stage. So kidney disease has 5 stages, stage 1, 2, 3, 4, 5, where stage 1 is close to being normal, but you have risk factor. Stage 2 is when the kidney function is more than 60% roughly. Stage 3, 30 to 60%. Stage 4, 15 to 30%. Stage 5, less than 15. And that's when people need dialysis or kidney transplant.
How or what role does family or genetics play in kidney disease?
It plays a big role. People with family history of kidney diseases, certain types of kidney diseases runs in the family. And if you have a lot of family members who have kidney problems, then the risk for you is higher as well.
If you have a kidney transplant, I don't know how prevalent kidney transplants are, but you would have to change your lifestyle or that kidney would become in disease. Or is that true or false?
Definitely. And if there are more risk factors when you have kidney transplant. You have to take care of your health. You have to take your medications, because if you don't take your transplant medication, then you can reject that kidney. So that's a big thing, and transplant is the best treatment option for kidney disease.
Is there an age more likely to deal with kidney disease than other ages?
So kidney disease become more prevalent as you grow older, and if you have diabetes, if you have high blood pressure, so those are the risk factors. But people who are older in age, they have high likelihood of getting kidney disease.
Equally spread between men and women?
For the most part, yes.
Yeah, most part.
There are some differences. There are some racial differences.
How long would the test take on Saturday?
Oh, it'll be instantaneous.
Yeah, just in and out, huh?
Yeah.
And again, will this be maybe I'm trying to think maybe in the fringe room. I'm not sure if they put that on there or not, or if they decided, but I would guess that there are going to be signs indicating people where they go for the kidney test.
There'll be signs. There will be a lot of fun activities there, so you can't miss it if you come to the library.
10 to 2 on Saturday.
Yes.
Say middle of the day this coming Saturday at Columbia Public Library. What else would you like to tell us about kidney disease and just overall, I guess, health that we can practice so that we avoid that?
The main thing I want to focus is being aware of it. And then if you have kidney disease, then making sure that you are doing adopting a proper lifestyle, reducing your weight, managing your blood pressure, managing your diabetes, because really prevention is the key. The kidney function, once you have kidney disease, it's going to go down with time. We can control how much it goes down by the choices we make in our lives.
Diabetes type 1 and 2 or just type 1?
Both type 1 and 2.
Really?
Yeah.
If you have some concerns about your kidneys, you'll want to make sure that you go by Columbia Public Library on this Saturday from 10 to 2 for the kidney disease test there, which will include, again, a BMI test, a blood pressure test. What else did you say, doctor?
There'll be a risk survey, which is a questionnaire, blood pressure check, body mass index measurement, a urine test, and a consultation with clinician.
All right. So any questions that you have, you could ask them there. Well, doctor, it's good to see you again. Thank you.
Thank you so much for having me.
Dr. Kunal Malhotra from MU Healthcare about the kidney disease screening, which is coming up this Saturday at Columbia Public Library. You're listening to Columbia Morning on KFRU.